1. What is the primary purpose of the National Dental Examining Board of Canada, NDEB examinations? A. To rank dental graduates for employment placement. B. To assess competency for dental licensure and ensure public protection through standardized evaluation. C. To determine eligibility for specialty training programs exclusively. D. To replace provincial dental licensing requirements entirely. 2. Which adult learning principle is most effectively applied when preparing dental candidates for the ndeb clinical osce examination? A. Lecture-based instruction without hands-on practice. B. Experiential learning with simulated patient scenarios and procedural practice. C. Memorization of theoretical concepts without clinical application. D. Passive observation of videos without active participation. 3. In curriculum development for NDB preparation, which sequence represents the most logical progression? A. Advanced procedures, then basic skills, then patient assessment. B. Foundational knowledge, clinical skills, patient communication, then integrated case management. C. Specialty procedures before general dentistry. D. Random topic selection without structured progression. 4. What is the primary regulatory framework governing dental practice standards assessed by the NDE? A. American Dental Association guidelines only. B. Provincial and territorial dental regulatory authorities' standards and competencies. C. Federal healthcare legislation exclusively. D. Individual dental school curricula without standardization. 5. According to Bloom's taxonomy, which cognitive levels are primarily assessed in the NDEB written examination? A. Remembering facts only. B. Remembering, understanding, applying, analyzing, and evaluating clinical scenarios. C. Creating new dental procedures exclusively. D. Understanding basic terminology without application. 6. Which evaluation method is most effective for assessing readiness for the NDE OSCE examination? A. Multiple choice practice tests only. B. Mock OSCE stations with standardized patients and procedural simulations with timed feedback. C. Written case studies without clinical performance. D. Self-assessment questionnaires exclusively. 7. What are the two main components of the NDB examination process for general dentistry licensure? A. Written exam and oral interview only. B. Assessment of fundamental knowledge, AFK, and assessment of clinical skills, ACS. C. Theoretical exam and research thesis. D. Single comprehensive written examination. 8. When mentoring dental students preparing for the NDEB, which communication approach is most effective? A. Providing critical feedback only without positive reinforcement. B. Balanced feedback addressing strengths and areas for improvement with specific actionable guidance. C. Generic praise without constructive direction. D. Avoiding difficult conversations about performance gaps. 9. What is the primary focus of the NDB assessment of clinical skills, ACS examination? A. Theoretical knowledge only. B. Clinical competency through simulated patient care scenarios, including diagnosis, treatment planning, and procedural skills. C. Research capabilities. D. Business management skills exclusively. 10. According to andragogy principles, why is problem-based learning effective for NDB preparation? A. Adults prefer abstract learning without real-world context. B. Adults are motivated by learning that addresses practical clinical problems they'll encounter in practice. C. Memorization is superior to application for adult learners. D. Adults learn best through passive instruction only. 11. What is the typical passing standard for NDB examinations? A. Fixed percentage of 70% correct answers. B. Criterion reference standard based on minimal competency for safe practice. C. Norm referenced ranking against other candidates. D. Variable standard based on examination difficulty without consistency. 12. Which assessment principle ensures reliability in the NDB OSCE examination? A. Different examiners using subjective personal criteria. B. Standardized scenarios, trained examiners using structured rubrics and calibration sessions. C. Random evaluation without defined standards. D. Single examiner opinion without verification. 13. In curriculum design for NDB preparation, which principle ensures content validity? A. Teaching only the easiest clinical procedures. B. Aligning curriculum with ndeb competency statements and examination blueprints. C. Focusing exclusively on specialty procedures. D. Avoiding integration of basic sciences with clinical practice. 14. What is the primary purpose of the patient communication component in the ndeb.ca? A. To assess language fluency only. B. To evaluate ability to obtain informed consent, explain procedures, and demonstrate professionalism. C. To test memorization of communication scripts. D. To assess typing speed for documentation. 15. Which regulatory compliance requirement must candidates meet before attempting the ndeb examinations? A. No prerequisites are required. B. Graduation from an accredited dental program or equivalency assessment for internationally trained dentists. C. Completion of specialty training. D. 5 years of practice experience. 16. According to Kirkpatrick's evaluation model, at which level would measuring improved patient outcomes after ndeb certification fall? A. Level 1 reaction. B. Level 2 learning. C. Level 3 behavior. D. Level 4 results. 17. What is the role of the Objective Structured Clinical Examination OSCE format in the ndeb.ca? A. To provide unstructured clinical assessment. B. To standardize clinical evaluation through multiple stations assessing specific competencies. C. To replace all hands-on clinical training. D. To eliminate the need for patient interaction assessment. 18. Which mentoring technique helps dental students develop clinical reasoning for the ndeb? A. Providing all diagnoses without student input. B. Guided questioning, leading students to analyze cases and develop differential diagnoses. C. Avoiding case discussions until after examination. D. Memorizing treatment protocols without understanding rationale. 19. What is the significance of infection control and safety protocols in ndeb examinations? These topics are not assessed. B. Strict adherence is required and assessed throughout clinical examinations as fundamental to patient safety. C. These are optional considerations. D. Safety protocols are mentioned but not evaluated. 20. Which adult learning characteristic supports the use of simulation in ND preparation? Adults prefer theoretical learning without practice. B. Adults benefit from safe practice environments where errors can be learning opportunities without patient harm. C. Simulation is ineffective for adult learners. D. Adults only learn through direct patient care. 21. What is the appropriate timeline for NDEB examination preparation? A. 1 week intensive study is sufficient. B. Comprehensive preparation over months, integrating knowledge, skills, and clinical judgment development. C. No preparation is necessary. D. Only review the night before each examination. Which communication skill is essential when presenting treatment plans in NDB clinical scenarios? A. Using complex dental terminology without explanation. B. Clear explanation of diagnosis, treatment options, risks, benefits, and alternatives in patient-friendly language. C. Providing only one treatment option without discussion. D. Avoiding discussion of costs or alternatives. 23. What is the purpose of the equivalency process for internationally trained dentists seeking NDEB examination? A. To exclude international graduates from Canadian practice. B. To assess if international credentials are equivalent to Canadian standards before examination eligibility. C. To automatically grant licensure without examination. D. To require complete repeat of dental education. 24. Which curriculum development principle ensures progressive skill building for NDEB preparation? A. Teaching advanced procedures before basic skills. B. Scaffolded learning building from foundational concepts through increasing complexity to integrated care. C. Random exposure to clinical procedures without sequence. D. Avoiding repetition of core concepts. 25. What is the primary consideration when managing medical emergencies in NDB clinical scenarios? A. Medical emergencies are not assessed. B. Appropriate recognition, initial management, and activation of emergency protocols following current guidelines. C. Completing the dental procedure despite patient distress. D. Ignoring vital signs changes. 26. Which feedback model is most effective in ndeb preparation mentoring sessions? A. Delayed feedback provided weeks after performance. B. Immediate, specific feedback using the feedback sandwich or similar constructive model. C. Only negative criticism without guidance. D. No feedback to avoid affecting student confidence. 27. What is the role of evidence-based dentistry in NDB examinations? A. Evidence-based practice is not considered. B. Clinical decisions should be based on current evidence, clinical expertise, and patient values. C. Only traditional practices without scientific basis. D. Personal preference supersedes evidence. 28. Which assessment literacy skill is essential for NDB preparation instructors? A. Creating assessments unrelated to examination content. B. Designing valid, reliable assessments that mirror NDE format and competency requirements. C. Making all assessments exceptionally easy. D. Avoiding any clinical skills assessment. 29. What is the significance of radiographic interpretation in the NDEB examinations? A. Radiographic skills are not assessed. B. Accurate interpretation of radiographs for diagnosis and treatment planning is essential and assessed. C. Only theoretical knowledge of radiology is required. D. Radiographs are shown, but interpretation is optional. 30. Which professional development approach supports continued competency after NDB certification? A. Ceasing all education after passing examinations. B. Ongoing continuing education, clinical practice review, and staying current with advances in dentistry. C. Relying solely on initial dental education without updates. D. Learning only when problems arise in practice.